we'd like to be able to provide you this update with respect to our master facility plan. We've been at this now going back as far as, I guess it was November of 2015 when we started this process. So it's been a lot of work taken up to this point in time that we are today. There's a lot more, of course, that's going to go on, but we really did want to make sure that we were able to update those of you, our team members, who really will be affected by this over the course of the next upwards of 3 years. So there's a lot in behind here, a lot of preparation going into this. Just kind of give you some background. We chose to do this as a renovation project utilizing the facility we have today, rather than trying to start some brand new project, have another brand new building, and all that would have done would have meant that we'd have now new space to take care of in addition to the old space. We've done a wonderful job. If you look at our third floor of our St. Simon's Tower, our orthopedic and neuro unit, that's probably one of the nicest inpatient units you'll ever step foot in. We'd like to be able to replicate that. And I think we can do that in the areas we're going to talk about. But as I said, you really are going to be the ones that are going to have to see it. You're going to have to be dealing with it. We even had to basically ask them, would you mind quieting it down today so we can have this presentation since it is being recorded? But otherwise, you'd have heard some jackhammering around this as well. But that's the reality that we're going to deal with. But at the end of the day, we are confident that this is really what we need to do, not just for our patients today, but our patients in our community for the long term. And at the end of the day, after 3 years of this hard work, we think it'll be well worth the project and well worth the effort. So thanks for your time. And what I'm going to have is start with Marjorie to talk a little bit about the project. And then after that, you'll hear from Tripp Stevens. And then back to Krista Roberts will make some comments as well. So thank you.
Thanks, Mike. And again, welcome, and thanks to all of you for taking the time and interest to come and learn more about the project. As Mike mentioned, we're doing the presenting today. That would be myself and Tripp, by and large. We've been involved with the project since the beginning. You can see the fruits of that in some of the finished boards and architect renderings. We have a little video we're going to be able to show at the end to show you what the building's going to look like from the front when we get it done. And we're excited about it. These are the objectives of the presentation today, just to give you an idea of all of the things that are going to be going on over the next 3 years. Some of the reasons why we're doing this, I think we're going to get into that just so that you understand it is a big project, but all these things needed to be done. We talked about doing them in succession as opposed to simultaneously, and it would have been about 8 years to get them all done. So we decided to bite the bullet, spend 3 years, and work on all of it at the same time. Our volumes, our patient need has shown that we need some of these things. You're all familiar with our emergency department and some of the deficits we have there, the two-pipe system up in our St. Simon's Tower. So those are things that needed to be addressed regardless of what we did. So we're going to talk about the project, what's involved with it, give you some scheduling ideas to see when things are going to be happening. Show you some of our other team, outside folks that we've had to bring in to help us because of the size of the project. Some of the things that go on behind the scenes so that you can maybe have an appreciation for some of the work that you see the workmen, but not all the things that go into that. Tripp's going to spend a few minutes talking about our interim life safety measures and ICRA, which is our infection control process that we use for all construction projects, even our minor ones. And then we'll show the video. I'm going to turn this over to Tripp to talk about some of those things that I mentioned in our objectives. Thanks.
Well, thank you, Marjorie, and thank you, Mike. So jumping right in, the Master Renovation Expansion Project is really several projects that are really rolled into one. So the St. Simon's Tower, 4th and 5th floor patient rooms, we're going to be talking about that. The Emergency Care Center, which is really a renovation of the existing space as well as an expansion. Same with surgical services, it's a renovation and an expansion. On top of surgical services, that'll be a new tower that ultimately holds an additional patient floor on top of it. The central energy plant and all the behind-the-scenes infrastructure, we're going to talk a little bit about that. We're going to be adding a new elevator tower, but right out here in the courtyard between the Glen Brunswick Tower and the St. Simon's Tower, just for better connectivity and flow for patients around the health system. And then there's some enabling projects that we have to talk about before we can even start these that just have to move some things around to make room for it. So, I want everybody to understand why we picked these areas. Well, the St. Simon's Tower, it's our oldest patient floor. It was the 4th and 5th floor. They were constructed in the 1980s, and there's been no renovation since then. So some of the issues we're dealing with up there is a decaying two-pipe system. What a two-pipe system is there's essentially a pipe that supplies cold water and then brings that water back so it can be recooled. And then that cools the building. If you want to heat the building, you have to drain the cold water out of that, put hot water in it. So we don't have the ability to cool this room and heat this room. So patients don't have the control of individual room temperatures. Everything in that tower on the 4th and 5th floor acts as one big zone. So from a patient satisfaction issue concern, that's a big issue for us. And that ultimately, that affects our HCAP scores. The perception is that those floors just aren't as well maintained as the rest of the building because they're so old and they just are dated looking. And then that two-pipe system has degraded to the point that we experience pretty regular pipe burst and floods in that tower. The Emergency Care Center was originally constructed in '63 and expanded in '77, expanded again in '88, and then there was some of the older areas were renovated in '88 when the expansion was done, and then it's kind of a facelift in '95, but not really a renovation at the time. In 2003, we added the helipad connectivity, and just really that corridor was all that was renovated at the time. So the majority of the Emergency Care Center is '88 vintage. It's currently undersized for even the current demand, and then all the future projections, it's grossly undersized. So we're going to be renovating it and expanding it. It's an outdated, inefficient design. If anybody who's worked in that area, to get from one area, the nurse's station to a room or something, you kind of got to go a circuitous route. And there's no connectivity to Main Street. So if a patient is down there in the ER and their loved one needs to go get something to eat or use the restroom or leaves the ER for any reason, they can't get back in without having to go to the outside of the building and come back through the waiting room. And those mechanical systems, they're approaching end of life to the point that they need replacing, and to replace a mechanical system is about a 6-week project that we would have to shut down a large portion of the emergency care center. So we're going to phase the mechanical system in with the project in order to minimize the impact there. Surgical services, all the projects, it's the newest. It was built in '96, but the SPD that serves it is built in 1963 with no renovation since. So some of the challenges there is that our ORs we don't have enough of them for our future projections. There's no sterile core for the supplies. There's so the supplies are held in several sterile areas, but there's no common area where everything can be for throughput, et cetera. And there's just poor circulation. The SPD is on the first floor, the surgery is on the second floor. They're not even in the same tower. So to get supplies up to the OR, you have to make a circuitous route. And then the mechanical systems there are also approaching end of life. And same theory there. You'd have to do a long shutdown in order to replace them. There's staff in the main ORs and there's staff in the OCORs. Ultimately, with this project, we'll combine everything into one location. And then the ORs are not large enough to accommodate the newer technologies, which also presents a recruitment challenge. If a new younger physician comes in, they want to do the new technologies, those rooms are not big enough to support those new technologies. The central energy plant upgrades is more of the same. It was 96 vintage. This is approaching end of life. We're going to have to replace all that equipment anyhow, so it just makes sense to do it as part of this, do the expansion and the replacement at the same time, so that we're not replacing equipment and then coming back 2 years later and replacing it with bigger equipment. So we're going to increase the size of the equipment as well as replace it. And ultimately, the new stuff will be a lot more energy efficient, which will reduce our operating costs. So, and then why the new patient floor? Well, the conventional wisdom is that demand for inpatient services in this country is expected to decline. But, the reality here at the health system is that the inpatient beds, we've increased 16% from 2015 to 2017, which, all those who are involved in direct patient care know the bed crunch issue that we experience daily here. So this is just some of the data that supports the new floor. But ultimately, our average daily census back in 2016 was 176. In 2017, 186. And in January of this year, it was all the way up to 203. And that doesn't even account for the fact that is a midnight census. During the day, as people are coming and going, getting discharged and admitted, there's more people in the house than that. Just talk a little bit about the volume and needs analysis. What we did is we collected our current patient volumes and our operational metrics, and then we compared them against what the ESRI says is going to be the growth projections for Glenn County. And not only is Glenn County projected to grow, but it's also projected to age. So as the population ages and grows, the need for medical services in the community is going to be increased. So we compare that with our medical staff additions, our business plan, and what our growth looked like from medical staff. Obviously, you bring more medical staff in, that's going to bring more service in and create more demand. And then we looked at projections for 5 years and 10 years out so that we're building something that sets us up for the future. Not going to spend a lot of time on this, but some of the volume needs analysis just kind of show you, the process and where we went from and how we got there. Looking at just med-surg beds, you can see that there's an increase over time and what our, demand is going to be. Same thing with emergency care center counts. One thing I'll highlight here is currently we're seeing about 1,640 patients per room per year. That is above the national average and really above where you can have good throughput. So that creates a backlog in our emergency care center because we're seeing too many patients in that room per year. So as we grow and the need grows and the service grows, we're going to kind of right-size that and get us down to where we need to be, which is in the 1,300 range. This is for surgery. This just shows that currently we have 14 ORs, and that's what the data says we need at this point. When 2025, we're going to be needing 16 ORs, and this project is going to include those 16 ORs.